Hey folks, this is Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. Now this week's blog is called Why Nerve Root Injections Are the 51st Shade of Gray. See, we have a sense of humor. This week we compare shots in the neck or the cervical region. We compare them to spinal manipulative therapy, which is also commonly known as chiropractic adjustments. I've highlighted the lack of evidence for the use of the epidural spinal injections before. Certainly, the lack of effectiveness beyond that of just short-term reduction of inflammation. Epidural spinal injections have shown no benefit at all beyond some short-term pain and inflammation reduction, and zero usefulness in regards to long-term disability or the eventual need for surgery. Zero. A paper by Nancy Epstein in 2013 and published in Surgical Neurology International stated, although not approved by the Food and Drug Administration, also known as the FDA, not approved, injections are being performed with an increased frequency, 160%. They are typically short-acting and ineffective over the longer term, while exposing patients to major risks and complications. In addition to that information, there is research showing that each subsequent epidural spinal injection puts the patient at a 26% greater risk of spinal fracture down the road. Now my question is, why on earth are people getting these injections at such an alarming rate when the research is taken into account? Hey, I'm not making this stuff up. My only guess is that the research isn't getting taken into account. One would think that these injections would be on the decline. However, despite the research showing the ineffectiveness of the injections, the popularity of them have only increased. Don't take my word for it. Consumer Reports had this to say. Controversy surrounds these injections, and the use has increased dramatically in recent years, along with escalating costs. They went on to add, some experts believe that their growth reflects, in part, the rising prevalence of lower back pain, but others suspect it's driven by financial incentives. Our analysis of the evidence, based on a recent report by the American Society of Health System Pharmacists and several published reviews and treatment guidelines, suggests that while the shots might have limited value by providing short-term relief to some people, in most cases, people should try other measures first. I've been saying this for quite a while. Again, you don't have to take my word for it here. With all of that in mind, let's look at this week's research comparing the injections to chiropractic adjustments for the neck. Now here's why they did it. The authors wanted to attempt to measure the overall outcome in regards to pain improvement and costs of cervical nerve root injection blocks versus chiropractic spinal manipulative therapy. Now here's how they did it. The study included 104 participants. Each participant had a disc herniation that was confirmed on MRI. 52 of the participants underwent treatment via the nerve root block in the neck. 52 of the patients underwent chiropractic spinal manipulative therapy to the neck. The baseline pain scores were collected on each individual using the numerical rating scale, or the NRS. The numerical rating scale was also taken 3 months after the end of treatment to compare for improvement. Improvement was measured with the Patient Global Impression of Change scale. Now here's what they found. 86.5% of participants in the chiropractic spinal manipulative therapy group showed significant improvement. Only 49% of the nerve root block group reported improvement. So let's wrap it up. Subacute to chronic patients that were treated with the chiropractic manipulative therapy were significantly more likely to report relevant improvement when compared to the nerve root block patients. There was no difference in outcomes when comparing acute patients only. There are several safe, conservative, non-invasive, and cost-effective ways of treating neck pain, from spinal manipulation to spinal decompression for the case of bulging discs or herniated disc. all you got to do is just contact us at 355-3000 here in Amarillo, and we'll set up a free consultation, make sure we get all your questions answered. So the next time anyone tells you to get nerve root blocks or an epidural injection for pain that's resulting from a herniated disc, consider this blog and consider getting a second opinion from a doctor of chiropractic before undergoing what is mostly a useless and potentially dangerous treatment protocol. Be sure to visit us on social media, Facebook, Twitter, Pinterest, LinkedIn, Google+, and subscribe to our YouTube channel so you don't miss any important information. You can visit our websites at creekstonecare.com or amarillochiropractor.com. Also, please take just a moment to click that thumbs up button down below. It really helps us to get in front of more and more people with some information that we think is very pertinent. We'd really appreciate it. Again, this is Dr. Jeff Williams, Amarillo, Texas. Thank you.